All right, let's get right into it. We're about to pull apart a really fascinating medical case that starts with something totally normal, playing sports. But you'll see, it quickly spirals into a life-or-death situation. This is a story all about hidden triggers, some seriously good detective work, and a diagnosis that's pretty rare and, honestly, pretty shocking.
And, like so many of these medical mysteries, it all kicked off with something that seemed like nothing. For a 16-year-old girl, right in the middle of a basketball game, it just started with this: itchy palms.
But that little itch, it blew up into something way, way more terrifying and fast. This quote, right from the case file, really captures that moment of crisis. The itchy palms were just the first whisper of trouble. All of a sudden, her throat is closing up. She can't swallow. This is not just some minor allergy. This is a full-blown emergency.
So picture this. She's in the emergency room, and the medical team has to move, and they have to move fast. Their first job is to act like detectives, to gather every single clue they can to figure out what is going on.
So this is what they were seeing, the full clinical picture. And it was a lot more than just an itch. We're talking generalized pruritus. That's intense itching all over her body. Her eyes were swelling up, she had a diffuse urticaria, which is basically a full-body rash, and then you get to the really scary stuff: shortness of breath, wheezing, and tachycardia, meaning her heart was just racing at 110 beats a minute. This is the textbook definition of anaphylaxis.
And here's where it gets really interesting. The team realized, hey, this wasn't some random one-off event. There was a clear pattern emerging. A year ago, a mild thing while playing volleyball, itchy palms that just went away. But recently, the attacks were happening more often, and they were getting worse each time. And the one thing that connected them all? Exercise.
Okay, so we've got our trigger, exercise. But what's the actual underlying condition? Now the doctors have to do some real detective work. They've got to line up the usual suspects and start ruling them out, one by one.
First up in the lineup, a condition called cholinergic urticaria. Now, this makes a lot of sense at first, because it's also triggered by things like exercise and heat. So is this our culprit?
But when you look closer, nope, not it. And the giveaway is the hives. Cholinergic urticaria gives you these tiny little pinpoint hives. Our patient had giant ones. Plus, this condition can get triggered by something as simple as a hot bath. But her symptoms were only ever tied to actually working out. So, suspect number 1 is off the list.
All right, so what's next? Let's look at mastocytosis. This is a disorder where your body just has way too many mast cells. Those are the cells that go wild during an allergic reaction. Since exercise can set them off, it seems like another really strong possibility.
But, once again, a crucial lab test just tells a different story. It all comes down to a substance called serum tryptase. See, in mastocytosis, that level is always high. But for our patient, it only spiked during the attack, which is what happens in other types of anaphylaxis. Her baseline level was normal, so mastocytosis is officially off the table.
So, what's left on our list? The final major suspect is hereditary angioedema. It's a genetic thing, known for causing major swelling. Could this finally be the answer?
In this one, well, this is a slam dunk. Hereditary angioedema is defined by swelling without any hives or itching. And what were our patient's main symptoms? Right, intense itching and hives all over her body. It just doesn't fit at all. So with that, we've ruled out all the main suspects.
So, with all the other possibilities crossed off the list, all the evidence is now pointing to one very specific and pretty rare diagnosis. So after all of that investigation, all that detective work, what's the final answer to this whole medical mystery? The diagnosis is exercise-induced anaphylaxis, or EIA for short. It's a rare disorder where, just like it sounds, the simple act of physical activity can trigger a massive body-wide allergic reaction. And this progression here is the classic, terrifying roadmap that matches our patient's experience perfectly. It starts with these prodromal symptoms, a feeling of being tired, warm, that initial itch. That's the body's early warning system. If you keep going, it's followed by hives and swelling, and in the worst-case scenario, it can lead to total cardiovascular collapse. But hold on. The mystery actually has one more layer, because for a lot of people with EIA, exercise isn't the only trigger. There's often an accomplice involved. So you have to ask, what if food is a factor here? And this brings us to this specific subtype called food-dependent EIA.
And the way this works is pretty wild. So get this. Eat the specific trigger food alone, nothing happens. Go for a run without eating it. You're totally fine. But if you exercise within a few hours of eating that specific food, that's when you get anaphylaxis. It's the combination that's the problem.
And what kind of foods are we talking about? Well, here are some of the most common culprits. Wheat and shellfish are right at the top of the list, but as you can see, it could be anything from tomatoes and peanuts to even milk or soy. Figuring out this co-trigger is a massive piece of the puzzle for managing this condition.
Okay, so you have the diagnosis. Now what? The whole game shifts. It's no longer about solving a mystery. It's about managing the risk and living safely with this condition every single day.
And that means having a rock-solid emergency plan. The steps are simple, and they are absolutely non-negotiable. First, you stop what you're doing immediately. Second, you administer intramuscular epinephrine. This is the step that saves your life. And third, you get to the ER. Every single time.
0.3 milligrams. That's it. It sounds so small, doesn't it? But that's the standard, life-saving dose of epinephrine that the paramedics gave our patient. And within minutes, it started reversing her symptoms. It's just a tiny amount of medicine that makes a gigantic difference.
So living with EIA is really all about being prepared 24/7. That means carrying an EpiPen or other injectable epinephrine everywhere you go. It means learning to recognize those first little warning signs and just stopping. It also means smart things like avoiding exercise in really hot or cold weather. And for the food-dependent type, knowing and avoiding your trigger foods. And maybe most important of all, never exercising alone.
You know, this whole case just makes you think. We've just seen a severe, life-threatening condition hiding behind something as common and as healthy as exercise. It really makes you wonder, right? How many other rare conditions are out there, just hiding behind everyday triggers, waiting for the right clues to finally bring them to light?